Colorectal cancer in both men and women is the third most common cancer. In men, it's prostate, lung, and colon cancer, and in women, it's breast, lung, and then colon cancer. So the average risk is 5 to 6% throughout our lifetime. The average risk non-African American person should start their colon cancer screening at the age of 50. African Americans have a higher risk of colon cancer as well as a risk of developing cancer at a younger age. So because of that, the new recommendations are that African American patients get screening at the age of 45. However, if you have certain risk factors such as a family history of colon cancer or polyps, or certain cancers that you may have, or if you have certain diseases such as inflammatory bowel disease, you may need to have screening started at a younger age. The goal in testing or screening is actually to try to prevent you from getting cancer in the first place or actually detecting it even at an early stage. And what I mean by that is that almost all cancers in the colon start off as a polyp or a tiny little growth in the lining of the colon that can slowly grow and transform into cancer over a period of time. Now, not all polyps turn to cancer, but almost all cancers start as these tiny little polyps. And when you have these polyps, you don't even know you have them. They're just too small to cause problems. And when you have a cancer, it normally has to be really big before problems occur. Well, we don't want to wait till you're having problems to look. The goal in screening and evaluating is that if there's anything going on, you want to catch it when it's a puny little polyp that we can easily remove very simply and safely through the colonoscope. And by removing those precursors, hope to prevent you from ever getting that cancer in the first place. Well, there's various tests that are out there, but my personal belief is that the best test is a colonoscopy. And what that is that we give you a bowel preparation the day ahead of time, so it cleans out all the stool in the colon so we can get good visualization. Then we have you come in as an outpatient at one of our surgery centers. We give you a little IV in your hand, and through the IV, the anesthesiologist gives you some mild sedation. It's not a general anesthetic, it's just a little sedation. And while you're relaxed and sleeping, we look all the way around the colon and make sure that everything is okay. If we see any little polyps or any little growths, we remove them at the time of the procedure. Now, it doesn't hurt because you don't have any nerve endings. And again, by removing those polyps or precursors, hope to prevent you from ever getting a cancer down the road. There's also an entity that's called a virtual colonoscopy, which is basically a fancy schmancy CAT scan looking at the colon. The biggest disadvantage of that is it only can see what's going on, it can't treat what's going on. So it can tell you that you have a polyp, but it can't remove the polyp. And then those folks are referred for a colonoscopy to remove the polyp. Well, a colonoscopy, you can see it and treat it all at the same time. And with my patients, the hardest thing they complain about is not the procedure. It's the preparation that's the hardest part, drinking all that stuff to clean out everything the day before. That's the hard part. So you don't want to repeat it by having a virtual colonoscopy that you have a polyp and then have to do it again to do a colonoscopy. Following a colonoscopy, if you're an average risk person and you had no polyps that were detected, then the recommendations by the American Cancer Society are that you repeat it in 10 years. Now, if you have polyps that are detected, you're at a higher risk of developing polyps again and potentially getting that cancer down the road, so that you should actually come back sooner to get reevaluated. Typically, that's about 3 to 5 years, depending on the number of polyps and the size of the polyps. However, if you have higher risk factors like family history of colon cancer, inflammatory bowel disease, or certain cancers yourself, you may require having colonoscopies even more frequently than that.